that I wanted to be a nurse when I was 10. It was just intrinsic.
I wanted to be a nurse since I was 13. I was fascinated by anatomy and physiology and sciences, even at that young age.
When I first decided to go into nursing, I wanted to do something to work with people. Once I started my clinicals, I decided that this was the perfect job for me.
I started in 1977 when surgical daycare became a new concept. That's what got me into nursing. I loved working in the recovery room and getting people ready for the operating room. That was really a lot of fun.
My mom was an ED nurse for 30 years. Never thought in a million years I'd ever be a nurse. But then in school, I just did my internship in the ED, and I was hooked. It's fast-paced. You get to see a whole bunch of different things. You get to meet a whole bunch of different people.
There's so many different reasons I decided to be a nurse. One of them is being able to help people. It's an exciting career. I mean, you're seeing patients on all different diagnoses, you'll be able to help them, and you see how they, you make a difference in people's lives. I couldn't see myself doing any other job besides being a nurse. I truly love what I do. Put an IV in you, draw some labs. We never know what's gonna come through those doors. From simple as little fever as, cardiac arrest.
We do anything from triaging patients to starting lines in them to administering medications to assisting doctors and even just being a patient care advocate. We're a teacher. We wear very many hats as a nurse.
Take a deep breath.
I think the best part of CHA is the people I work with.
The nurse population is very diverse as well as the patient population.
We do see a large Hispanic population, and I am originally from El Salvador, so sometimes it's easy for me to communicate with them, and vice versa. They're more comfortable communicating to me things that they might not be comfortable communicating to other people, because culturally they feel that I might understand exactly what they're going through.
28, 29, 30.
We also have a very large psych population that we treat, so I get to utilize both my nursing degree and my psychology degree with the type of population that we have here.
The career paths here can lead to many different directions. I feel like I have a lot of options as I progress as a nurse here.
They're really working on the nursing, working to the top of their license now. I work closely with my providers and my medical assistants in taking care of the patients. We're truly a team.
What I love about CHA is that we serve a very diverse, large metro population, but we're small and family environment.
Well, that's the beauty of it all. We're not so big that we lose that feeling of family.
The nurses here are great. I've never had a time where I had a question and couldn't get it answered. Some of the senior nurses will come in and help me set up an IV that I've never done, or a medication that I've never given, help me, pull up the policy and figure out, okay, Jasmine, this is what you need to do, this is the next step.
We pull from each other. We have nurses who work very well under pressure. We have nurses who are smart, they have the ideas and the answers right on top of, so we use that, each other's strength. And when we do have crises like we do, we always pull together and support one another.
We all know each other in the hospital, and you know who to go to see when you need something, especially quick.
You're made to feel like you're really part of the team and your contributions do matter. To me as a nurse, I know my main goal is to serve, take care of these patients, and do the best I can.
Every day, the nurses that I work with, we're always constantly helping each other out.
I feel like I'm never alone. I feel like they're always there to help me and always there to back me up. And that, as a nurse, is one of the most important things that you can have. And when you're working, in a unit of, at times, high stress. So it's great to have the people there that are going to have my back.
This is one of the nicest groups of nurses that I've ever worked with. We really support one another. We care about one another. I mean, they really become your second family.
It's the best team I've ever worked with in my whole career.
How many people can say they have a job where they love doing and also that they can actually make a difference?
This seemed like a perfect job, and I love it.
I love it.
Love nursing.
I love it.
Once a nurse, always a nurse. It's a great profession, and I'm proud that for 39 years, I've been that.
To the nurses at CHA, I love you, and you make every day a better day. for me and all the patients here at CHA.